Hi, everybody. My name is Ian Alrawan, and I'm a senior at the University of Texas at Austin. Today, I have the privilege of interviewing for my thesis in the UT Austin AI Health Lab, Dave DeCaprio. Dave DeCaprio is the Chief Technical Officer of ClosedLoop.AI, and he is also an awesome business leader and entrepreneur.
ClosedLoop.AI, I'm Chief Technology Officer and co-founder here. We founded the company about 5 years ago. I have a background, we're a healthcare machine learning and AI company. So we built a healthcare specific data science platform. I have a background in that space. I started in healthcare about 20 years ago, working on the Human Genome Project at MIT. That was really on the life sciences side. So dealing with, we called it pattern recognition. The marketing people hadn't gotten to all of the techies yet. So it wasn't AI or machine learning. It was just pattern detection in DNA is where we started. But computationally intense machine learning methods to mine the human genome. Essentially, I fell in love with healthcare at that point, and I'd always kind of loved computational side of things. And I did that for a few years. Decided academics wasn't really my thing. Got into drug discovery. Did that for a few years, and then realized at some point that I didn't think the problem with the U.S. healthcare system was that we didn't have enough pills. And so I was like, I'm here in drug discovery. If I do a great job, I might find 2 new drugs, and that would be a knockout career. And then there would be 2 more pills on the market. And is that going to fix healthcare? And I just for the record, there are wonderful people in the drug discovery industry, and they create life-saving treatments. And I don't mean to poo-poo that at all. It just wasn't for me the thing that drove me. So I started thinking at that time about what were the problems in healthcare that if it wasn't that we don't have enough pills, then what were the problems? And specifically, I started thinking about what were the problems I could do something about. There's a lot of problems that are like maybe the system's messed up and the incentives are all wrong. And maybe if you're the president or you're in Congress, you can do great things there. But those weren't problems I felt like I could address. I did kind of land on this problem of, are we really using all the right data to make all the right decisions at the right time? And the analogy I go back to is, if you look, the amount of computational horsepower and insight that goes into deciding what ad to display to you on TikTok or Facebook or whatever your age is, your appropriate social media platform. There's an incredible amount of analytics, data science, machine learning that goes into picking the right ad. And when you go to your doctor, we rely on a very highly trained person to understand all of medical literature, and they don't have the tools. And not just in the individual doctor-patient interaction, but all kinds of decisions about healthcare are made really without using the right level of data. And so I thought, that seems like a big problem, and I'm a data guy, so maybe that's the problem I could tackle. So I've spent really the last 10 years tackling that. 5 years ago, we founded ClosedLoop to sort of a separate. I did that with other companies originally, and then with ClosedLoop now for 5 years, trying to tackle that problem.
When you kind of narrowed in a bit on that problem, what translated to deciding that you wanted to compete in the Centers for Medicaid and Medicare Services, like AI Outcomes Challenge?
Yeah, so this was this contest that was sponsored by the Medicare agency, and the $1.6 million challenge. The contest was announced in March of 2019. And I think the day it was, within 2 hours of it having been announced, there was probably 4 or 5 people who emailed my co-founder, Andrew, and I, 4 or 5 people emailed us, like, hey, this contest sounds like it's relevant for you guys. It was exactly what we were doing, looking at longitudinal patient histories from claims and prescription data and trying to predict future adverse health events. So this was exactly what the contest was based on. And so literally within the first day that it was announced, 5 people were like, this seems like exactly what you do. And so there wasn't really ever a decision for us on, are we going to do it? I mean, we just knew immediately we were going to do it. And the only concern was at the time, I mean, we were probably a 7 or 8 person company when that contest was announced. It was, very early in our history. And so we weren't really sure at the beginning we could be competitive. We thought we were good in this space, but the competitors were IBM Watson and Merck and Geisinger and some very large, well-established names in technology and healthcare. And so, but we were a startup, and we were 7 people. So we went out and we said, all we did at the beginning was submit an application. And then from there, we got to the first stage. And then ultimately they narrowed it down to 25 and then to 7. And for those who want to know the punchline, this little company in Austin who no one ever heard of won the whole thing. So we were able to win that whole contest. And I think that was clearly very important in our history. I think there's it's very easy to start an AI company and say you have magic technology that can predict the future. And it's not always easy for customers to distinguish who are the people who actually have technology from the people who are just saying that. And so winning a competition among 400 other teams over the course of 2 years, sponsored by the federal government, went a long way towards distinguishing that, yeah, we actually know what we're talking about here. So,
how do you think that competition informed the creation of the platform? I see a lot of emphasis on the platform within ClosedLoop's interaction with clients. Was that like a driving force?
Yeah, and so just talk specifically about what we actually do. We have a healthcare data science platform. So it's a software platform, a software as a service platform that takes in healthcare data and allows data scientists to quickly pull together data sets, enrich them, and then build machine learning models based on that. And so we're not really trying to sell an individual model or technology as much as a machine that builds models for people. I think that had always been the vision of the company. I think one interesting thing the challenge brought up was we always believed that the key to doing healthcare data science well was understanding the data very well, having a platform that allowed you to experiment very quickly and try a lot of ideas. Linus Pauling said that the best way to have a lot of good ideas is to have a lot of ideas. And so, I've always believed in that many of the things we try are not going to work out. So we built a platform that enabled quick experimentation and allowed us to build in a lot of the healthcare domain knowledge and real insights on the data that we'd gotten and sort of package those things up. So we knew that's what we wanted to do. I think what the contest did was allow us to prove that was a very effective model and a very effective way to build machine learning applications in healthcare. And just to contrast that, another way, some people thought it was all about the magic algorithm. It was all about like using the fanciest deep learning technology on the newest GPUs and it was just a matter of like who could build the fanciest thing. And from having run the experiment now, the answer was you have to do a lot of things and you have to do a lot of them well, and your ability to rapidly experiment was really the thing that allowed us to distinguish. At the start of the contest, we made a list of about 257 different ideas we wanted to try, and we tried every one of them. But most of those did not work, but some of them worked, and some of them worked very well. And I couldn't have told you which ones would have worked at the beginning. And so it was just a matter of being able to chunk through 257 ideas over the course of that time period that mattered in that.
Could we talk a little bit about how moving forward as a data science platform with clients trying to help patients, how do you actually provide that return on investment to a client and help patients?
Yeah, so for all the great things that contest did, one of the things it didn't do was help any patients. It was a machine learning contest, and we started the company really to focus on actually improving healthcare, and that means improving patient outcomes. healthcare is a complicated, it's a complicated industry. It is not as simple as a typical industry where you have customers who buy a product and they pay for the product and then they get it and they move on. You've got insurance, you've got, so the patients are not usually paying for the healthcare. It comes from insurance. The incentive systems are not always aligned. So if you're going to build a business around healthcare, you really need to understand that whole ecosystem and how it works. There is a big trend in healthcare called value-based care, which is essentially trying to shift the incentive system so that doctors do better financially when their patients are healthier, rather than making more money by treating sicker patients. And this is an overall, certainly national trend that's been going on. One of the things that trend has done has shifted. The shift in incentives has created a shift in kind of how the business models operate. For these value-based care organizations, they actually can make more money by lowering the total cost of care across a wide patient pool. And so they start to, when that is your goal, you start to shift how you think to more proactive care. Instead of just reacting, once someone walks into the hospital, how do I treat them effectively? It's, hey, how do I prevent that person from ever having come to the hospital in the first place? And so a lot of the actual tools and customer engagements we have is working with these value-based care organizations, looking at their patient population and trying to predict in advance, hey, who is likely on a path that's going to lead to some very expensive event? And I'll use it, negative outcomes, very unplanned admissions, all of these things line up. The things that are bad for patients and the things that are expensive tend to line up. And so once the incentives are set up like that, if you can figure out who to provide the right preventative care to so that you prevent a hospital stay that was unnecessary, you've got a happier patient, you've got a lower total cost of care, so you've got people being healthier, and you're addressing sort of things like staff shortages at the same time. If we need less staff, then we will have the impact of staff shortages is less. So there's a lot of ways in which having these kinds of predictions and being able to intervene more proactively can make a real difference in patients' lives, and also ends up being good business in these value-based care incentive things. And so that's what we focus on. And really we try to focus on very practical, we don't like the big pie in the sky kind of transform everything with AI. We like to start with very simple, let's find existing decisions that are being made. Let's figure out how to bring all the information to bear on those decisions and do a better job. And do it on the decisions people are already making today. And I think that's important. It's very easy to get lost in this space with all the wonderful things technology might be able to do. But, in the end, people are either using it to make decisions or they're not. And if they're not, it's not really doing anything. And that goes to not just overall, but how quickly, when we engage with customers, the very first thing we try to do is figure out, okay, how do we get in this cycle of you using this technology right away? The sort of long pole in the tent in terms of getting this technology out is never the math. It's always the process changes and getting people to understand and buy into what's going on so that you can change the decision. That's always the hard part. The time to actually build the model and do the math that's never the blocker. So.
Talk a little bit about maybe the blocker of discovering exactly what outcome a client wants to predict, because it seems like it's easy to predict the wrong things or
So in healthcare, you often don't have the exact answer that you want. And I think there's a corollary to this in a lot of AI things. So, like data labeling is often a difficult problem. And in healthcare, because we get somebody's health history over time, if we're interested in what happens in the future, we can always just look into we can go into the past and look into the future and see what happens. So in some sense, the data itself is somewhat self-labeled, but you don't always have exactly the thing you're interested in. Usually, our customers are interested in, hey, I want to find all of the people who are, usually the question they're asking is, I want to find all the people who are going to benefit from having this intervention. And that's not something that's really in the data. And so you have to sort of approximate that. And so, well, I want to find all the people who are likely to go to the hospital. Well, pregnant women are likely to go to the hospital, but nobody gives you credit for predicting that. Everybody kind of knows about that. So it's really kind of unplanned hospital admissions that people are often interested in. And then, well, how do you determine from the data whether admission is planned or unplanned? Your appendicitis burst. Well, that's pretty much always unplanned. Or pregnancies, normal delivery at the end of a pregnancy is always planned. In the middle, there's a shade of gray. Well, what happened if you maybe had emergency heart surgery that you kind of knew it was coming and you thought you were there, but some event happened and it happened quickly. So there are all these situations that get a little bit tricky. And so one of the important things we find is talking with our clients about what is it you're trying to accomplish and how do we look in your data to figure out exactly what it is we want to predict. It's a variant of the data labeling problem. But in our case, we usually have it, we know what's happening. It's not like you're going in and trying to label individual examples, but you're trying to figure out, what do I want to predict that's close enough to the actual thing I'm interested in that it matters.
I think that's one of the powers of having the platform as opposed to a specific ML model, is that you can have a client, you can work with them specifically on like what features to select. And then Andrew's talked about how every population and every data set is different per client. So I didn't have an organized question there, but
yeah, it's very true. It's important. So the kinds of things that we run into, I talked a little bit about unplanned hospital admissions. Well, if you look at a Medicare population, so people 65 and up in Southern Florida, unplanned hospital admissions tend to be things like falls or complications due to advanced diabetes or COPD, so lung disease, right? Those are the kinds of problems that generate hospital admissions for a older population in Florida. If you, and we have customers down there. We also have customers who are treating Medicaid populations in New York City. So you have the Medicaid populations, you've got a lot of mothers and children, poor mothers and children, and you've got things like asthma attacks that kids who live in New York City and public housing, and they're getting asthma problems. That's very different from hip replacements. Both are unplanned hospital admissions, but the models and approaches and the things that are going to work are very different in those. And so in those two cases, and so it's important when you do this that you not take sort of a one-size-fits-all approach in healthcare and in building this machine learning models. The model you need for that New York population is different than the model you need for that Florida population. And that's why we focus not on trying to build something to predict everything, but we work on having a platform that allows the group in New York to take their data and learn what they can from it, to figure out how to deal with that population. And that same platform can be used to take the data from the group in Florida and help them learn from their population. The result will be two very different models that learn different things, but the process and the platform and the tools are exactly the same. And so that's kind of part of what our focus is building that tooling that allows each organization and each group to sort of learn from the data they have. And that's, for the state of healthcare today, that's really important because the problems are different, the data is different, and even the way the system works is often different in different places.
And there's so much. There's so much to talk about there. One thing I'm curious about is just there's these huge advances from, the government leading the value-based care strategy and how that's affecting private payers, but also just if there's integration of AI into clinical workflows, I'm kind of curious as to how important do you think it is that physicians, medical students, residents become like literate with machine learning?
Yeah, I like to approach that question as, look at what computers are good at.
Yeah.
They're really good at scale.
Yes.
Very good at doing things very fast and at large scale. They are very good at consistency, doing similar things, repeatable things consistently, and eliminating variation in the process. Those are the things computers are great at. Like creativity, empathy, and insight are things that people are good at. And so, will doctors, the kind of who's going to get replaced or whatever, I think for me, it's more like, well, what do we should we be using the computers for? Is I think about if a doctor has, if a doctor has 2,000 patients they're responsible for, but they see 10 in an average day, right? So you see 10 patients. Maybe maybe computers can help the doctor do a better job treating those 10 patients. But what I'm sure the computer can do is do a better job of monitoring the other 1,990. We're generating data on all those people. They're filling prescriptions. They're going to see their other doctors. They're messaging back and forth. There's all kinds of things going on that's being collected. And your average, you can't expect the physician to keep track of what's going on with those 1,900 people on a daily basis. That's exactly what computers are really good at. And like you said, it's some of that gets to raising the red flag on, hey, we're looking at your prescription. We've noticed you stopped taking this prescription you have for statins. That's an important prescription. Given where you are, we think this is important. Maybe we should proactively reach out to that person when we've noticed they've stopped taking their prescription. That's the kind of thing a computer can be very good at. And it can be very good at not at some mystical time in the future, but like today. And so that's where we need to start focusing on using this technology. What does that evolve to? I don't know. I'm not good at that game. I don't think I make a living predicting things, and one of the important things is to know what you can predict and what you can't. And trying to predict where technology is going to go is very tricky. So I tend to avoid that. I do know there are lots of areas today in terms of who should do proactive outreach, patient monitoring, and operating at scale and a level of consistency that there's tons of opportunities today. And I think the next generation of technology is going to come from seeing where that technology worked, where it didn't, and then building on top of this. And we'll get surprised. That's all I know. So that's what I'll predict. But doctors aren't going anywhere, and neither are computers. So both are going to be around.
Well, thank you so much, everybody, for listening. Thank you so much, Dave, for doing this. And I hope that you got something enjoyable, entertaining, and informative out of this. And please check out the work of ClosedLoop.AI and the work of the AI Health Lab by Professor Ying Ding at the University of Texas at Austin. And yes, thank you so much.
Thanks. It was great being on here, Ian.